Dimitrios Kostopoulos.
So good evening, everyone. I would like to thank you for joining us tonight in this presentation. I'm the co-founder of Hands-on Care Physical Therapy. This is an organization that provides physical therapy to people throughout the New York area. And I would like to thank also the Mount Sinai Medical Center Parkinson's and Movement Disorder Center, and especially Dr. Barbara Changizi, Will Bernholtz, who you saw a moment ago, Amber Servi, and Elenita, who arranged and made this presentation possible. So, we're going to do this very interactive. I'm not going to be up here talking for an hour. But I am here to find out also more of what would you like to know. And I will facilitate this process through some questions. For example, when I say the word physical therapy, what comes to mind? Has anyone ever received physical therapy here? Okay, very good. So what comes to your mind when you hear physical therapy, the word physical therapy?
For me, it was neuromuscular retraining after being hit by a car.
Okay, neuromuscular retraining after being hit by a car. Okay, that's part of physical therapy. Very good. What else? Will?
I had shoulder surgery.
Hold on a second. Let's get you the mic so that.
I had a shoulder injury and injured my shoulder and had to do physical therapy after the surgery, and then years later because I didn't do physical therapy well after the surgery. So
I see.
Follow up.
Okay, so you're telling us a little bit here what happens when you don't get.
Yeah, I learned about the effects of not getting and not doing proper physical therapy.
Let's see, that's very interesting. Okay.
I tore my ACL downhill.
Okay, let's get you a microphone real quick.
I tore my ACL downhill skiing, and I elected to have very intense physical therapy instead of surgery. And then I went back to downhill skiing afterwards.
Okay, very good. So, anybody else? So you have had, several of you have had some sort of experience with physical therapy. And, you know, I would say that physical therapy, I'll give you the official definition of physical therapy in a second. But physical therapy, it has various components when applied to patients with different disorders or dysfunctions of the body. And it has to do a lot with the training and expertise of the specific person who applies the therapy. So, sometimes I have a problem with people referring to physical therapy as I had physical therapy. I would prefer that somebody says, I saw a physical therapist, because actually the quality of the work that you are receiving and the actual intervention that will be applied to your body will have very much to do with the specific physical therapist who applies that therapy. Let me give you an example. You may say sometimes, well, I saw a neurologist. Or you never say, I received neurology. But why do we say I received physical therapy? You see, a neurologist A will treat a patient in many ways differently than neurologist B. The same way, physical therapist A will treat a patient differently from physical therapist B. And in my 25-year experience in the field, both as a clinician as well as an educator, I have seen this time and time again, because there are different schools of thought, different universities, different programs, different educational levels that can bring someone to the point of applying a specific physiotherapeutic intervention for a disorder. Now, many of you have had physical therapy by a physical therapist, and most of you at least explained the positive results of that. But besides the specific physiotherapeutic intervention that you received, did you follow up with any, let's say, home exercise programs, with any exercises? You did? How many of you did?
I was supposed to.
You were supposed to. Did you? You did not. And we saw the consequences to that, right? Yes,
I did.
you did. So what happened that you did?
Because I wanted to be able to do what I'd done before. I wanted to be able to downhill ski. But I have a question for you. Why
Sure.
don't you say I did physical therapy rather than I had? I see why you don't say had, but you have to do it too. You have to participate with the practitioner.
Absolutely. And you see, I thank you very much for this remark, because quite frankly, when you go to see a physician and the physician gives you a prescription, right? You have, for a specific medication, you have to actually go through the motion of taking that medication, going to the pharmacy, picking up the medication and taking it, right? And follow instructions, maybe so many hours before food or after food or whatever that specific regimen would be. But for physical therapy, we have something very similar. You have to actively participate in that process. So there are things that you have to do to help the process. And actually, in today's presentation, I want to discuss with you some of the things that someone who has a Parkinson's disease can do to help themselves and improve their daily activity level and functional level. And as you will see in a moment, what I will talk to you about and the ideas that I will discuss with you are not going to be simply, okay, do this little exercise or do that exercise. I will present to you, I'm not going to treat you as just lay people who have never read or researched the subject. I will treat you as people who are very educated on the subject, and I will present to you the scientific evidence how specific types of exercises help and why. So, well, because of that reason, I want to make clear that in the event I use any terms that you do not know, please let me know and I will explain to you what I mean by saying that. So I will provide you hopefully useful information regarding the nature, benefits, and the expected results of physical therapy, but also of home exercise problems for whether you have been diagnosed with Parkinson's or you care for someone who has been diagnosed with Parkinson's. Now, we talked before about the definition of physical therapy. So, physical therapy is an art and a science that addresses and restores motion takes care of one particular part of the body or the entire body. Physical therapy also works with prevention in many, for many issues. Physical therapy can help prevent dysfunctions, movement dysfunctions. And in most cases, it can handle the underlying cause of a patient's problem. Okay? Not necessarily all the time, most times. So, at some point, most of you have been referred to by your doctor to physical therapy. And why did your doctor send you to see a physical therapist? Because your doctor understands the benefits of physical therapy, because he or she wants to see your function and motion improved, your gait improved, to some regard to prevent future injury or dysfunction, and for specific cases to decrease pain. So you went, you saw a physical therapist who did a comprehensive assessment and started implementing a specific treatment plan, and he or she was in communication with your physician. But look, the results of the outcomes of that therapy, on the one hand, have to do with the kind of condition that you had and the severity of that. But on the other hand, they have to do also with the kind of physical therapy that you received for the specific physical therapist. You recall when I started my presentation, we say, on the one hand, we say, I saw this neurologist or that neurologist. We don't say, I received neurology. But on the other hand, we say, I received physical therapy. Okay? But as I said, neurologist A may treat you in some different way than neurologist B. In medicine, there are standards, there are guidelines, but at the end of the day, the differential might be a little bit different, or a specific neurologist may be more advanced in their knowledge and expertise on a specific subject. Same way with physical therapy. I will say physical therapy, but you will receive a different type of physical therapy from physical therapist A versus physical therapist B. So much of the outcome that you will receive will have to do with what kind of physical therapy and what kind of physical therapist you are seeing. The physical therapist you are seeing, for example, is he or she just having you do an exercise just because? Or they have you do a specific exercise regimen because they are aware of the scientific evidence that this specific exercise works in a specific way, and therefore we have specific outcomes that derive from that. That's very important. It can make a world of a difference. So something very interesting when it comes to exercise is that the past 10 years, we had a much greater understanding of the effects of exercise in various disorders, especially movement disorders. And we're able to see via scientific evidence how different types of exercises affect the specific components of a movement disorder. So, as I said, when we're talking about exercise, and what I'm going to talk about tonight is not going to be anything like that.
Philips Expanium, 10 hours of music on one CD. Don't say we didn't warn you.
Okay, so we don't want to see that kind of thing, right? So, now, In Parkinson's disease, in terms of characteristics of the movement, we deal with tremor at rest, rigidity, bradykinesia, and postural instability. And this is something that, since you have read or being exposed in real life with this type of disease process, movement disorder, you probably are very aware of that.
I don't know what bradykinesia was.
Oh, we have Dr. Zanghisi here. Dr. Zanghisi, will you join me? Come up here. Come on, let's do this together on this. Dr. Zanghisi is a very good friend, and initially I thanked her for inviting us here today. The mic has a little problem. I don't know if we can fix it from there. So let's talk a little bit about. We talked about bradykinesia.
Oh.
So how would I exhibit bradykinesia?
Yeah, so bradykinesia just means slow movement. It's just the lack of movement or problems initiating movement. Another word for it is akinesia, lack of movement. Kinesia or kinetic is movement, and brady is slow.
And it's Greek word, right?
Brady, yeah.
Slow, and kinesia, kinesis, meaning
That's right.
movement. Okay, fantastic.
Sure.
Thank you. All right. We'll do it. Stay close so you can help me.
Okay, no problem.
All right. So now let's look some of the evidence. First of all, when it comes to physical activity, research shows that people with Parkinson's disease, they have a greater reduction in physical activity level than other individuals. So, number one evidence then is that we have less of a physical activity level in people with Parkinson's disease. Now let's see how this connects to the next piece of evidence. Now, inactivity, it accelerates the degenerative process of Parkinson's disease. So that's the one side of the coin. Well, the other side of the coin is that moderate and high levels of physical activity are associated with lower risk of developing the disease. So this, 1992 study, reconfirmed in 2005, states basically that people who are engaging in moderate to high levels of physical activity, not only that will help the cardiovascular system, not only that will help the brain function, it will specifically decrease the risk in developing Parkinson's disease. It's very interesting. Now, another study showed that regular physical activity can delay the onset of the symptoms in patients who have been diagnosed with Parkinson's disease. Okay, so if someone gets diagnosed with Parkinson's disease, when they engage in a good, appropriate amount of physical activity, that will delay the onset of the symptoms of the disease. Now, the first type of exercise that would be very helpful in people with Parkinson's disease would be exercises to increase general mobility. 10 weeks of exercise improved the mobility of the core of your body, of your trunk, the trunk mobility, which is very essential. Movement is being initiated by your core, by your trunk. And also it improved postural control, which is so important in patients with Parkinson's disease. So exercise exercises to improve mobility are general exercises. Any kind of general stretching exercise, any kind of general strengthening exercise with very light weight, any kind of participation in light sports. And then, if we look specifically at exercises to improve muscle strength, first of all, data shows that muscular strength is reduced significantly in patients with Parkinson's disease compared to individuals who normally, not normal, but the individuals without Parkinson's disease. And also we observe something very interesting. And this is what can make a big difference also in your rehabilitation program or in the home exercise program that you're doing. That this weakness of the muscle system that happens in individuals with Parkinson's disease is not weakness that happens throughout the entire body at the same time. It's kind of selective weakness. There's a selective pattern to it. You're going to see more weakness exactly in those trunk muscles, the axial muscles, the core muscles, and also weakness on the muscles of the lower body, especially on the hip area, on the hip muscles. And that is also extremely important, because one has to really understand this concept when they prescribe for you a specific rehab program, specific exercise program. So now strength training programs will be effective not only in increasing the muscle strength, but also mobility in individuals with Parkinson's. And I mentioned that even before when I talked about the general mobility exercises. So the first type of exercise then are general mobility exercises. And then the second type of exercise that will be helpful would be muscle strengthening exercises. So muscle strengthening exercises can be very simple. I'm sure that those of you who went for physical therapy, your therapist gave you this TheraBand, right? It's like an elastic band that provides resistance. You can very easily use this elastic band, putting it around your waist, attach it to a doorknob, and start moving away from the door with your body, initiating movement and moving forward, and that TheraBand will provide resistance. But also exercises like this, called bridging exercise, right? Or this tabletop exercise. Exercises that will, this one, the airplane, I call it aeroplane exercise. These are exercises that will help to increase the strength of your core muscles. And this is something that would be very, very important. Now, people with Parkinson's, they have balance deficiencies too. And those balance deficiencies can lead actually to falls. That's why 66% of individuals with Parkinson's suffer falls, and 46% recurrent falls. And depending on the age of the individual, those falls can be very detrimental. So we need to do balance exercises. Now look, when you go to physical therapy, to see a physical therapist, they're going to do different type of balance exercises for you. There's various pieces of equipment that they can use to help with balance. But then, in your life, after physical therapy, there are a lot of activities that you can engage in that can help tremendously with balance. And one of my very favorites actually is Tai Chi. Tai Chi can help tremendously with balance. Any kind of martial arts, but Tai Chi is very very smooth exercise, very low impact exercise, and also there is something very interesting in Tai Chi that specifically for Parkinson's disease can help at a different level. It is the fact that Tai Chi provides a rhythm. It's like a rhythmic exercise. In Parkinson's disease, we like this rhythm. This rhythmic type of movement helps actually in the initiation of movement. So it is a great type of exercise. I totally recommend it to anyone doing Tai Chi. Pilates, many people do Pilates, and many gyms offer Pilates programs and other facilities, and I think that is a fantastic type of exercise that can also help with balance. Now, general physical conditioning exercise, simple things, simply aerobic exercise programs on a regular treadmill, and even walking showed improvement in gait and quality of life in individuals with Parkinson's. It's pretty recent study. And I would add, those of you who have a dog, it will keep your walking not only continuous, but it will make it more fun. How many people have a dog here? Let me see. Nobody has a dog?
Yeah.
You have a cat?
He died.
Oh, okay. I'm so sorry for that. Okay? So here is my dog. Her name is Sandy. Not like the hurricane. Okay. Yes, you can ask me a question.
I've heard that you need to get your pulse rate up in certain well over 100 for half an hour to 40 minutes a day in aerobic exercise. Do you agree with that? Is that right?
That's a very good question. And actually, I will tell you that the study that I quoted before, right here, okay, these studies, all of them actually, this was actually a great one. But all of these studies, when they do aerobic exercise, they monitor the heart rate of the individuals to maintain it at aerobic levels. And for each of us, the aerobic level of exercise that one has to engage in is different. For example, I'm 47 years old. I'll be 48 in a couple of months. The level of aerobic exercise, the rate, my heart rate has to be at a different level to do aerobic work than someone who is 17 or someone who is 70. So when you see your doctor or your therapist, they can explain to you for your individual age and also your specific condition and state of physical state at that period of time, what would be the appropriate aerobic level for you. But also, let me remind you that it is not necessary to try to achieve aerobic levels only by walking, by fast walking. There are exercises that somebody can do that they can actually get into an aerobic level using their arms. The same way that there is a bicycle for the legs, there are different types of equipment that look like a bicycle for the arms that somebody can do and get into that aerobic level. Exercises to improve gait. So gait-related mobility problems have definitely a negative impact in the quality of life, right? And the simple treadmill exercises and training that I talked about before can be more effective than other type of more complicated exercises. So we don't have to be extremely complicated in our selection of what type of exercise to engage in. Simply doing a treadmill activity can offer a similar benefit to what I talked about before in terms of Tai Chi. You remember what I said about Tai Chi? Tai Chi has this rhythm. Same kind of thing with the treadmill. The treadmill forces you to have a specific pace on the exercise that you're doing, and this rhythm helps tremendously in the various receptors involved in the generation of your gait.
The Bud Light Institute would like to proudly introduce the ToeFlex, specifically designed to make it easy to burn the ridiculously low carbs in one Bud Light. The ToeFlex can be used anywhere.
Work it. Good.
It helps work those difficult toe muscles.
I can actually feel the burn.
Of course you do.
Breathe.
So get your toes into shape the Bud Light Institute way. Fresh, smooth.
So, and something even more interesting, which is that actually exercise can have a significant benefit in the brain's health in individuals with Parkinson's disease. Exercise can restore motor function through a variety of various molecular repair mechanisms in the basal ganglia. And we see actually that patients who receive at least twice a week an exercise program, we can have a better level of secretion of neurotransmitters that would be helpful in patients with Parkinson's disease. So it can offer, exercise can offer a neuroprotective effect. Now, before I give you my final remarks, I want to ask you if you have any questions. We said that what is important is to have general type of exercises for mobility, and general type of exercises for mobility one can have by getting involved in any type of stretching program. Yoga, for example, can help in that. We have then strengthening exercises, but we said not any kind of strengthening. So the kind of strengthening that the guy did before, strengthening the biceps, it would be less useful for a patient with Parkinson's disease. You need exercises to strengthen the core, abdominal strengthening, for example, or strengthening of the gluteal muscles would be important. Okay? Strengthening of the hip muscles and of the leg muscles would be important. Yes?
Is there any literature on proprioception work with Parkinson's?
Yes, in the area that I talked about here, in terms of somato, let me find it here, the stimulation of somatosensory and vestibular receptors, there is research that demonstrates that, again, this frequency, low frequency, I would say about 16 to 24 hertz of stimulation on a vibration plate could be very helpful to help initiate movement. So that's a very good question. So, improvement of balance, improvement of gait. Yes?
I've noticed.
Hold on a second, let's get to the mic.
I've had a very recent diagnosis, maybe 8 weeks of Parkinson's. But what's interesting is that I found that I was told by one leading neurologist everything except exercise. Nothing came up. And as he was walking away, I said, are you interested in exercise? He said, oh yeah. I said, how much? He said, well, an hour a day will be fine. But it was not motivating me. But everyone else who knew about it was saying, these are laymen, do this. So I've taken Tai Chi, dancing, yoga, and all of them have different, I would have thought dancing, but it becomes very interesting, this changing, as a musician, changing patterns of rhythms and structures.
That's a very good point.
And I have felt better. I want to say that outside, my fear of falling has changed. I purposely take stairs and feel much more balanced.
That's fantastic, and that's a great feedback on that. You see, my point presenting to you today was not to present to you my opinion, but to present to you the scientific evidence. And that's why behind every single statement that I made to you today, you saw it was backed up by a piece of research. Okay? I didn't want to talk to you about exercise in general. I wanted to talk to you about what does the current scientific evidence shows about exercise for Parkinson's disease. And there is a ton of evidence, as you saw, that supports that exercise can be preventive for Parkinson's disease as well as for many other problems, but also it can delay the onset of symptoms. Moderate exercise can delay the onset of symptoms, which is really great. And of course, it can help later on when the symptoms occur. It can significantly help to improve somebody's quality of life by increasing their functional daily activity level. Yes?
Could you define moderate exercise?
Moderate exercise? Okay, that's a very good question. It depends on what type of exercise we're talking about. If we are talking about an aerobic exercise, meaning being on a treadmill, a moderate level of aerobic exercise would be a level where when you are doing your fast walking on the treadmill, you can easily have a discussion with somebody else without feeling out of breath. That would be moderate. Okay? If very mild level of aerobic exercise would be for you leisurely to be on the treadmill and being able to file your nails at the same time. Okay? So moderate level would be the level where you can exercise in a fast pace, but at the same time have a conversation without being out of breath. And high level of exercise would be when you cannot have easily a conversation with somebody because you're going to be huffing and puffing. Okay. Now, when it comes to strengthening type of exercise, anaerobic, not aerobic, but anaerobic type of exercise, a very mild type of exercise would be exercise that you would do without any problem, without feeling any significant effort, a complete range of motion for 3 sets of 10, for example. A moderate level of exercise would be a level where you can still do 3 sets of 10, but you are feeling the effort. And then a high level of exercise, or an anaerobic level, would be exercise where you won't be able to fully complete the 3rd set. You see? So that would be the distinction there. Any other questions? So, anyhow, you are more than welcome to stay in communication with us. I'll invite you to go to handsonpt.org to receive our newsletter and other educational materials. And feel free to see here Ilan from Hands-On, who will be very, very happy to give you even a free consultation card from us for joining us today. But once again, I would like to thank you so much for giving us the opportunity to have this talk with your group. And we hope to see you again sometime in the future. And good luck to all of you. Thank you so much.